Good morning, good morning, good morning if you are joining us on the replay. Good morning if you're joining us live and you're just signing in. Welcome to Mobility Magic on a Monday. And it's our first Monday back after reopening in Ontario. So welcome to you if you are joining us at home, if you're joining us from the office, if you're joining us in the gym right now and you want to join in with mobility, welcome, welcome, welcome. We're going to get started on some hamstring, some calf, some lower back work today. So it's going to start with the feet, work up into the hamstring, the calf and low back. And welcome again if you're joining us right now. Hello to you all, hello to the regulars if you join us on a weekly basis, lovely to see you. Give you a minute and then we're going to switch off, or about 10-20 seconds, and we'll switch off the comments, unfortunately. But if you have any feedback, we'd love to hear from you because we really like to shape these sessions based upon the information that you give back to us. So if you want to follow me on my Instagram page at @FashionStretchSimon, you can reach out to me there, or you can message on the video replay. But unfortunately, the comments that we get, we don't actually get to see afterwards, so they don't save those. But if you want to comment, it will really help us to kind of shape the sessions. Without further ado, let me get underway. I'm just going to sign off from the commenting, and I'll turn it back on right at the end. So first thing you're going to do, as normal, is you're going to grab your lacrosse ball. We'll start with the feet. If you know what to do, go ahead. You'll also need today a foam roller and potentially a towel or like a band. We're going to do some hamstring stretches with that. I also have a chair available just in case, because I'm going to use my bench today, but I'm going to show the option for the chair as well. We're starting below the big toe, and we're just going to put a little bit of light pressure into just below that big toe. We want to be able to bring our toes up and down. So the pressure you want is about 7 or 8 out of 10, and we're just looking for pressure that's in your kind of range of 1 to 10 of discomfort. So toes are coming up and down. We're getting some work just to loosen up and mobilize tissue around the toes, just below the knuckles of the foot. And the idea here is we're actually moving quite slow. A lot of people do this too fast. And with this, we're just looking to spend some concentrated amount of time to get that tissue kind of loosened up. So I'm just starting to move across my foot, left to right, up and down, just to get that tissue worked out. I'm moving to the middle of my foot, there or thereabouts. I'm doing the same thing. So my toes are coming up, trying to splay those toes nice and wide. Then I'm coming down, I'm scrunching them up. You'll notice the pressure increases slightly. I'm up, and I'm down, and again. Scrunching, opening up, closing, I'm expanding, closing, I'm expanding. Okay, so we're coming down now towards the heel a little bit. So we've gone across the top of the knuckles, from the big toe to the little toe. We're now kind of in the middle of our foot towards the heel. This is kind of where the plantar fascia attaches, or at least has one attachment. So we're going to push a little bit down into it, and then we're just going to lift our toes up a little bit. And this time we're actually going to turn from side to side. So we're just rotating, getting that tissue. I'm keeping my weight into the ball. The ball's the one that's turning, and I'm getting that tissue to kind of unscrew from the base of the foot. Now I'm just going to come to the outside, also the inside edge, just below my big toe, and I'm just working it up and down. And by now you should probably find that your foot's nice and loose. You should find the tissue's kind of loosened up a little bit. Again, the idea here is to regularly work that foot. It's the first point of contact with the ground, which is why I like to do it on a quite frequent basis on this channel. So we're starting from the base of the big toe, just below the knuckle. Toes are down. We're pulling down to the floor, and then we're lifting all the way up. We're pushing down, 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 and we're lifting all the way up. So we're trying to splay those toes at the same time. We're getting nice and wide, just so we can get that tissue stretched in lots of different directions. And up, and down, and then we're moving across a little bit. If you can imagine, if there's tension in that foot, it's a bit like having your t-shirt pull on one side. If I've got the tissue nice and tight down here, it's going to be very difficult for me to raise my arm, whereas if I have tissue built up on my foot, it's very difficult for me to do anything further up the chain on the posterior. So that's why we like to really start off on the foot. So toes are coming up, toes are coming all the way down, coming up again, and coming all the way down. And just really scrunching those toes. I'm really trying to get it to do some work here. The tension is starting to release from my foot. I'm getting that splayed toes at the end. And now we're just working it down towards the middle of that foot. Reposition your foot if you need to. Want to make sure that we're not being too aggressive here. Enough pressure, about 7 or 8 out of 10. And we're just going to kind of corkscrew the foot a little bit. Kind of get it to unwind. Get that foot to start to roll a little bit. Try to open that tissue up. So now, let's work the inside edge from the heel to the toe. Heel to toe, heel to toe. Good. Awesome. So that is our release of the plantar fascia. We're going to move on to a little bit of calf work now, particularly starting at the tendon and also the hamstring tendon too. So let's start at the hamstring tendon first. Now you can do this on a chair, so if you want to grab a chair, grab that. I'm going to do it on my bench, a little bit more surface area, but either works fine, or you can even do it on the floor. Now, if you've done this one a few weeks ago, you'll remember that we put the lacrosse ball just underneath our butt, so it's not quite in our glutes, but it's actually where the hamstring kind of inserts towards the sit bone, which is the bony prominence underneath your buttock, towards the start of the thigh. We are going to put a little bit of downward pressure into this area. It's going to get a little bit uncomfortable. You want your chest nice and tall because you want our weight over the top. And unlike our normal mobilizations, releases, stretches, etc., this time we're actually focusing on around the tendon. We want it to kind of release a little bit. So it's localized. This will help you stretch that hamstring later. So you'll notice you may even get a little bit of tightness on the front of the hip as it's pushing the femur up into the acetabulum, the top of the socket, and the ball is just below my glute, as I said. Now I'm starting to shift my weight forward a little bit, and now I'm just going to extend my leg just slightly. So there's a little bit of downward pressure on your thigh if you need it. We're extending the leg, we're bringing it back. It's a little bit of a hamstring curl at the end, just to add some more pressure into the ball. Extending, and then I'm curling downwards and back towards me. So it's like a little bit of pressure into the bench. I'm extending, up, toes are coming towards me, and then coming down, 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 down. So curling up, and then bring it back down again. And then all the way up, and back down again. Awesome. And all the way up. Excellent. So feel free to move the ball again if you need to. You want to make sure we're hitting all of those heads as it kind of feeds into that tendon. You could move it inside or outside, whichever works for you. You can even move it very close to the inside edge, so it's more into the adductors. That also works too. It's this just small movement and this shifting of weight backwards to front that's really going to help you with that stretch. So if it gets really intense, just back it off a little bit. If you're just tuning in, my lacrosse ball is just into my hamstring tendon, which is why I look like I'm not doing very much. I'm just kicking my foot forward and backwards. This pressure alone will help you release the tendon a little bit. And if it gets really, really intense, just back it off and we'll switch around. So I'm going to move on to the other side now. This already feels a little bit looser, which is great. Same thing. Probably start with the middle position and then pick a side and work towards that. We're putting it straight underneath, near our sit bone. So towards the top of the hamstring. And if you're like me and you have slightly like discrepancy, it might be a little bit higher on one side than the other, and that's fine too. So shift your weight a little bit just to find that position where it feels tightest on the outside or inside of your leg. And then we're just going to lean our body weight forward. You can hold the bench as well if that works, and we're just going to shift and try and straighten that leg. This side's a little bit tight on the other side, so I'm just going to back off that pressure a little bit. I'm going to try and stretch that foot away from your, at least extend the knee, so get that full extension and create some distance. And if you're someone who has any lower back concerns here, just make sure you're nice and tall. If you can be, if it's a flexion-based intolerance, and obviously just be careful if you're in any other position. So you can also bring your foot in and out. You can kind of do these windscreen wipers. They also work. But we want to make sure that we're rotating along an axis here, so you can use your finger to kind of make sure that you're turning kind of this way like a rudder. Okay, so again, just the last few passes, make sure that you're on one side or the other. Again, that's really going to help you to kind of release that hamstring. And now we're going to move on to some Achilles work. So a couple ways you can do this. You can have foot across your heel and do this. I'm going to show you this way so you can kind of see. But all we're going to do is we're going to relax our foot. So now my foot is plantar flex. I'm going to take the heel and I'm just gently start to work it away from the from where the Achilles attaches. So where the Achilles tendon attaches down the bottom, and I can start to play with it a little bit. I'm just going left to right and just kind of moving it, just seeing where it gets tight. And then if I find a spot that's kind of tightish, I'm just gonna just kind of hold it to one side. Could be towards you or away, just depends on which way you're stuck. And when we just bring our toe towards us. So I'm just putting a little bit of light pressure away from me this time. I'm just dorsiflexing my foot. Okay, I'm just working it up, not too much pressure. I'm just kind of working the Achilles tendon backwards and forwards now. And the idea here is you can try and get this Achilles tendon unstuck. It's going to help feed into those hamstrings that get tight as well. So it's a little bit of love for your Achilles tendon. We're just kind of massaging it. And then what you can do is you can start to work the tissue down towards the Achilles. So a couple ways to do it there, just to get into your calf. The next phase you're going to work through is we're going to work up towards the meat of the calf starting. So we've come from the tendon all the way up. Now we're giving it a little bit of a pinch just where the tissue starts. We're just holding that just ever so lightly. You can also do this with the lacrosse ball. So you can pin it and bring it towards you. You can pin that bottom of the Achilles tendon and just bring it towards you. We're just working it away from the Achilles tendon a little bit so you can pull it towards you. And just work its way up as you go. So as you kind of get that release, it's just a gentle one here. You don't want to do too crazy and bruise it. And then what you do is you work on the other side. So we're now pulling, using the lacrosse ball up. So if you look on this side, I'm just pulling away from me. So again, we're using the foot to do all the work. We're applying a little bit of pressure into that calf and just pulling the tissue away from it. Just so we can create a little bit of a release through the whole calf. Now the nice thing is once you kind of get this released, so it's going to help feed into the hamstring. Sometimes I like to start from the top down, but today we're actually working from the bottom up. So we've done the foot, and we've done the tendon at the hamstring. Now coming back down to the calf, and we're working this tissue up as we actively move our foot. I can turn around so you can see the other side now. So again, first place to start is going to be that Achilles tendon. You can do it with your fingers, or you can do it across your calf, relaxing the foot, plantar flexing it, and then we're just working that tendon. So you just be really gentle, you don't be too aggressive, and we're just working it away, just moving it backwards and forwards as much as we can. We can also do windscreen wipers here if we want to, but for now, you're just going to make sure that you're plantar flexed and that you're slowly massaging the foot upwards. So I'll do it on the bench for you again. We're just moving this Achilles tendon backwards and forwards, away from you and towards you, making sure that we're nice and plantar flexed. Get into a position where this is all relaxed. You want the Achilles tendon and the Achilles, so the calf, so the gastrocnemius all being relaxed through, and we want to work our way up just to see if it gets tight anywhere at all. So one side might have tightness, one side might not. Not a problem. When you get to that point, obviously work through it. Now I'm going to start to either just gently squeeze my fingers together, just clasping it lightly and just working it towards me. Just gently. So again, like 5 out of 10 is fine. Don't need to bruise yourself or cause any issues. We're just working backwards and forwards. Now, you can also do this with your lacrosse ball. We pin the tissue down. We're just going to use this as a tool to pull it away from the Achilles tendon. So we're just pinning it a little bit, pulling it upwards, and doing the same thing. I'm just plantar flexing down and then dorsal flexing upwards, just getting that movement through the calf. And I'm just going to pull that tissue up as I go. So I'm just creating some distance between these 2 points. Same thing on the other side. I'm going to do the same thing. I'll let you also kind of play with it a little bit, just to kind of see what works for you. You can also do this by pinning your weight into the lacrosse ball as well, or a foam roller, that also works, and we're going to do that in a second. And so we're just working it all the way up. So grab your foam roller, or we can do this on the floor, you can do this seated on the bench. I'll turn around so I can do my right side first. So same idea, but this time what you're going to do is you're going to put some weight into it. So you can do this on the floor if you want, you can do this on a chair, you can do this on the bench, whatever works for you. Just make sure that you're able to put some weight downwards. So if you're on the floor, you just lift your hips a little bit and that works fine. And again, we're just going to go to where we need it in the calf. So this time we're actually starting in the middle of, towards the meat of the muscle. We're going to put a little bit more weight into the calf here, and we're bringing our toes towards us just a little bit and then away from us. And this time, as we get our toes away from us, we're really going to try and force that foot into some plantar flexion, just so that tissue starts to go on kind of a stretch. And then now we're pulling our anterior tibial, so we're pulling our toe towards our nose, and we're getting a stretch here, and now this is all on stretch as we're pushing our weight into it. And now we're bringing it all the way down. It's loosened up, it's slackened off. We're pulling down, we're putting more weight into this calf, and you should feel a little bit of tension on one side. So whether it's you're turning inwards, so our toes come in, or we're coming outwards, my tension tends to be more on the outside. We're now pulling our toe towards us, we're getting that toe towards our nose, and now we're plantar flexing, I'm turning out slightly, I'm letting that tissue kind of relax. And take as long as you need on this one. And then we just do one more pass. So I'm really pulling towards my nose, I'm really trying to get that toe to my nose, and now I'm plantar flexing downwards, really trying to get that toe away from me now, as I turn my whole leg outward slightly. And now I'm coming back to center. So let's switch sides. Same thing again on the other side. And if you're on the floor, same deal, just lift your hips a little bit, with a little bit downward pressure, put some weight into that calf when it's on slack. So start in the middle of the muscle belly here. Toe is going to be away from us, so we're plantar flexing, we're extending away. The weight is coming down. This time, I myself am caught up on both sides on this calf, but again, you can turn in or out depending on what you need. And our toe is away from us this time. We're trying to get our toe all the way down, so we're pulling down, and we're putting some weight into that calf. And now we're pulling our toe to our nose, making sure that leg is straight. And we're getting this anterior tibialis to do some work. This muscle in the front doesn't really do much unless you make it work, but it protects you from things like shin splints and so on, and knee issues. And if you're like me with poor range of motion in your calf, this will also help that too. So now we're plantar flexing away from us, we're pulling down. So toes are going down towards the floor, really pulling down. You might get a stretch on the front of your foot. Feel free to turn it in and out if you need to. I'm going to slightly bias my foot outside and see what happens. And now I'm toes towards nose again, I'm pulling up, making sure my weight's a little bit forward, get a little bit stretched. You might also get a stretch on the hamstring. And now we're pulling down, so we're plantar flexing down. We're turning our foot outwards a little bit. And now just for a little bit of a bonus, we're going to roll our calf side to side, keeping our toes straight. We're just kind of rocking from side to side just to get a little bit of movement there. So just a couple of ways to release your Achilles tendon. We're going to work into a little bit of a psoas release. So we're going to come straight down to the floor. Get rid of my lacrosse ball for a minute. We're going to lay on the foam roller. So we've done this one before. We're going to do a psoas release and a QR release. So we're going to lay on the floor. This time we'll start on the psoas and then go into the QR rather than the other way around. We've done it before. So important thing for this one is going to be laying with this portion. Probably a poor choice of colours today because this is orange and this is also orange. But we're going to lay on the left side of our belly button towards just above the hip bone at a slight angle. So slight angle of the foam roller. We want to make sure we're hitting the right area. We're going to come down to the floor. We're going to spread our weight just on the corner, the start of that foam roller, with enough space that your belly button is kind of bang on the edge of the foam roller, and then you can sink your body weight down. So hopefully you can see me clearly here. Hopefully the foam roller sticks out enough against my shirt. Again, poor choice today if we're doing this because the foam roller is orange. But weight is sinking down into the foam roller. We're taking a nice deep breath in. If you have any low back issues, be aware that you just need to advocate for yourself and make sure this isn't too much tension on your low back as well. So nice deep breath in, breathing into the foam roller, breathing out, breathing out, breathing in, breathing out, breathing out. So we're just getting that tissue to relax. We're just sinking, 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 letting our body weight sink into that foam roller. We're also going to lift our hip a little bit too. Now we're lifting our hip, so I'm going to bring my knee off the floor on my left hand side. I'm creating a little bit more stretch. You can also reach out away from you. So we're kind of creeping our hand away from us. We're creating a stretch through the middle of the body. And now we're just going to switch sides. So again, this one, we're just trying to create extension. We're trying to get a little bit of a kind of a teasing of the middle of our body. So this time we're going to switch onto the other side. I'll come at a slight angle so you can see it the other way. But the idea here again is to get a little bit of a stretch through the front. So we're opening up one side at a time, and we're getting that so as to kind of release a little bit. It's not going to release completely. You obviously need to do some active work with strengthening, but this will also help to release that too. So laying on foam roller, just laying our weight into it. We're just going to let ourselves sink in for a second and take a nice deep breath in. As I breathe out, I'm just letting myself sink in. Each out breath is when you want to do the sink into the foam roller. Just letting you sink in. And when you're comfortable, you've got two options that you can try. We can extend our hand away. And just reach, 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 and creep that hand across the floor. We can bring our knee off the floor, extending our leg. Don't have to raise just yet, but that is also an option. And then also, if you want to, you can lift your torso up. Now, if you have any low back issues, that one could be contraindicated for you, so I would just be aware of that too. Now we're going to come into a QL. So this is the other side. Same thing. I want to put our weight on the one side. So we're just going to slightly lean away. So now we're concentrating on that same portion of tissue on the opposite side. So now we're focusing on this QL, this kind of squarish muscle that sits at the low back that can be responsible for a lot of discomfort. Now, you can let your hip hang down and really concentrate here, but just be aware that because we're causing rotation of the hip, this can cause some irritation for some people. So weight comes down into the foam roller. We take some nice deep breaths. Deep breath in. Just breathing out. Let's do 5 of those. So we've done 3. Last one. I feel a nice release. Should feel a little bit of pressure shift on the back there. I'm not going to bother tapping around this time because I think you can understand what I'm going for here. But I'm just putting my pressure, my weight into the corner or the end of this foam roller. It wants to be on the side of your spine. So you don't want to be on the spine, you want to be at the side of the tissue, and you want to be able to add enough pressure by dropping your hips down so one side of your butt is resting on the floor and the other one is below the foam roller. So in effect, you're doing the opposite to what we just did in the psoas on the back. And if you need to readjust because maybe you get a little bit of release and you need to catch more tissue, just roll down. As long as you're not on the ribs, you should be fine. We're just trying to capture as much tissue as we can. And let's just take 3 breaths. Let's sink down. And one more time. Let's sink down. So, release the front, release the back. I want to come from this position into a little bit of a stretch. So you've got 2 options at this point. Towel, that will work, or I like these green bands. They also work well. Something long that you can use. If you have like a yoga band, that also works. You've probably done this in a yoga session before. We're just going to do a little bit of active stretching of the hamstring. So a little bit of PNF in this too. We're just going to stretch right now. You can, if you don't quite have the tools right now and you want to come back to this one, I'll repost the video straight after the session for good life purposes. We're going to push away, actively stretch it, pull it down towards the floor. And then on the out breath, we're going to come back up into a deeper stretch. So we're just going to breathe in, breathe out, breathe in, and then breathe out again. Breathing in, breathing in. Feel the stretch of the hamstring. Doing a little bit of PNF now, so we're actively going to pull that hamstring down, pushing down towards the floor. And then we're just going to hold it in that position. So we're just actively using a hamstring, letting it relax, letting that inhibitory response take hold. That autogenic reaction, sorry, on the side. And then we're down. This also works again with the towel, because we're just trying to look for control. So now we're dropping it down to the side. I want to try and open our hip up a little bit too, because it's going to creep into the adductors. So I'm turning my body, and I'm going to bring the hamstring all the way back up again. So you want to kind of do a clock face if you can. This time we're going to come all the way down towards the bottom of the body, keeping this leg straight. So straight up to the ceiling, toes towards us, going to help with that stretch. And you want to come as far as you can, keeping that leg straight. So if there's any bend there, I would try and avoid that. If you can't lay this leg flat, fine. You can use this one to balance with the same. We're coming down towards the floor, we're coming around and back up again. Also going to help with that hip. So let me just come back just a little bit so you can see the bottom of my foot on this side. And I'll move across a little bit too, I think, just so I hit the bench. But important thing for this one is we'll on stretch in a position which doesn't feel painful. You just have a stretch awareness. So this side's a little bit tighter just behind the knee. So I'm going to hang out where my leg is straightest. I'm going to work my way up until it's about 90 degrees. So going to bring this foot down by pushing it down. If the band stretch is fine, if the towel stops you from moving all the way down, that's okay too. Coming all the way up, making sure we're moving with a breath. Deep breath in, down, relax. Feel that stretch, pull your toes towards you. Deep breath in. Deep breath in all the way up. We're going to come around. Back to the middle, coming all the way up. Coming around. Coming all the way around. Getting a stretch through the hip. Getting that kind of clock rotation as we come all the way down and through the middle. And what you probably notice is as it gets more and more relaxed, you get a little bit more range up into that 90 degrees. So, last couple of things we want to do, and we're doing great on time, is we just want to do a last activation for that hamstring. So, simply all we're going to do is we're going to stand in front of this wall. We're going to make sure we're nice and stable. So if you need something to stabilize that leg, feel free to do that. and we're actually going to push our heel into the wall and squeeze our butt. As we do that, we're lifting our toes as well. So you need to stabilize yourself on the wall, that's fine. If you need something in front of you, that's cool too. We're pushing back into the wall, getting a little bit of a hamstring activation and glute activation, and also activation of this front foot too. So pulling the toes up on the foot that's pushing into the wall to make sure that we're getting that calf and that hamstring, and we're pushing back, keeping our body nice and tall for that glute. So it's kind of a 3-4-1 if you like, 4-4-1. Pushing this heel into the wall this time, actively pushing in, actively pushing in. Make sure we lift up our toes on this side. Push, 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 push. Make sure you're nice and balanced. Driving the toe into the ground. Push, 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 push. And relax. Let's do 2 more. We're pushing into the wall. Push, 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 push. Squeeze the butt. Pull the toes upwards. And then one more time. We are push, 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 push. Toes are coming up. Back into the wall. And relax. So that would be a really great way to kind of finish, get that activation of those calves, hamstrings, glutes. Nice bit of activation at the back too. I'm going to turn off, or turn on the comments I should say. Thank you so much for joining us this week. If you stayed to watch, thank you so much. If you're watching on the replay, you're awesome. Please leave your comments below. Love to hear from you. If there's anything you would like us to cover, please do message me directly. And if you have any questions, anything particularly you'd like me to answer for you, you can also message me as well. I'll try and help. All right. So thanks so much. I will see you next week at 11:30 as usual on Mobility Magic, and I'll repost the video straight after this. So thanks so much for your time. I'll see you soon.